everyone, it's Alicia and Dr. Bilski of Bilski Dental Group, and we're here this week to discuss PRF gum lifts. There's a couple different procedures that you're going to be talking us through, so I'm just going to turn it over to you to let us know.
Sexy, right? PRF gum lifts.
Yeah, very.
Not talking about that at the breakfast table, probably, right?
If you know what it is. I mean, some people might be like, what the heck is he talking about?
Yeah.
Right?
There's more than one way to correct or help a patient with gum recession. Okay. And we talked earlier in another video about the pinhole surgical technique, which is a very nice way of fixing your more minimal gum recessions. Another way is dermal grafting or acellular dermal grafting. That's tissue from a cadaver. So, and then the third one is a gum lift, which we use platelet-rich fibrin, PRF.
Okay, there it is.
Right, those are the mesenchymal cells that are like stem cells. It helps your body to heal quicker. So it's a clot that we can fabricate by drawing blood with our phlebotomists that work with us, put in a centrifuge that spins it. So in other words, we take the cream of the best byproduct of your blood sample that we take.
Okay.
We're able to make a small opening, a little bit bigger than the pinhole, loosen that gum tissue a little bit, and slide that PRF in there. And there's plenty of video that you can see that animated so it's not gory. Yeah. And it works very, very well. The reason we would use that would be if somebody was opposed to cadaver tissue. There are some religious people or patients that would prefer not to have that. With the pinhole, it's a collagen product, which either comes from a cow, bovine, or another type that we use, porcine, pig. Okay. You may have a religious belief that should not be used too, or it just doesn't make sense to you to have that. And the last one with the PRF, and there are some religious sects that prefer not to have that too. Okay. I'm just saying the three that we use are pinhole surgical for small procedures, the acellular dermal grafting, which is a wonderful product and a procedure that I prefer because we're correcting the thinness of the gum tissue. So it's a bone loss and a thinness of gum tissue. It's a 0.5 millimeter. That's 5 human hairs. It's not very thick. I like thick gum tissue. So the acellular dermal graft or the PRF helps you to get thicker gum tissue. Okay. Collagen does as well. I just know when we have a significant amount of recession that we must correct, that the latter two, the dermal grafting and the PRF, we use PRF like Frank's Red Hot. Okay. We use that on everything. Yeah. So it's a wonderful way of healing wisdom teeth, tooth removal, implant dentistry, certainly gum recession, or periodontal plastic surgical procedures.
Okay, so really can be involved in all of that.
Absolutely, yeah.
All right, wonderful. Well, this video really is just an educational video to let people know the different options that they have. And,
certainly, yeah.
If that sounds like something that you need, maybe you need a consultation. Bilski Dental Group offers free consultations, so you can come in and talk to one of the doctors and just discuss any questions that you have. And if that's you, you can get in contact with them by making an appointment. You can give them a call or visit online to find out more at bilskidental.com. Thanks again, Dr. Bilski.
Thank you. You're welcome.